These are what we call the back patterns. They are the pain patterns common with what we call reversal patterns. This is any type of scar tissue force or injury that causes the body to go down towards gravity. These are some of the most common pain patterns that you see show up with your clientele. The one we're going to be covering today is the C1 Release Technique. That's number 8 on this chart. You can see it down here at the bottom. So what we are going to be learning to do is how to work through the structures of the face, the chin, and the clavicle to change pain along the occipital ridge, or the C1 occipital pain. These are all the areas that scar tissue can form in the reversal patterns. There are platforms called the neck reversal platforms, the lower leg reversal platforms, and then the pelvis patterns. These are a stabilizing force between the neck and lower leg reversals, and those forces are responsible for the common back patterns you see here. When you want to do the C1 release technique, the first thing that we're going to do is we're going to assess the occipital ridge. So there are essentially 7 points. You're going to have 3 points along one side of the occipital ridge and 3 points along the other side, and then you kind of have a center point. That's going to be your 7th point. And what we're assessing is tension or tightness along that occipital ridge. So we'll go ahead and come in and do that. And I'm going to take that central position, which is that first one, check that first position, and then the second position, and then the third position. And then I'm going to do the same thing along that other side. So there's that first position, second position, and third position. Your client will feel like you're just doing some occipital work as you assess this, but what you're looking for is what is the tightest. And on this particular client, it's this point right here on the left side. Now, what that information gives you is where we are going to work on the facial structures to release that occipital ridge. So there's a couple areas that we work. We have the chin right from here to here, and it's about from the smile line, the lip line, all along this bottom part of the chin. Then we have nasal sutures and tissue on the nose. Then it comes down as it goes into that zygomatic arch, and it's going to come all the way around, and there's a couple other suture lines through here. And then the zygomatic arch actually goes all the way out past the ear onto the skull. And what these areas line up with are each one of those points we just talked about. So that most central point, which is kind of right on the spinous process of C1, is actually going to be anything that's kind of in this midline. So it would be anything along the chin through here and these nasal sutures right here. A lot of people who have stitches along their chin or they have broken their nose, they're going to be really tight at that central point, that 7th point, right in the middle of that occipital ridge. Now, that first point that we start on, right next to that central point, is going to be anything that's through this area here. It kind of mirrors what's going on in the back. And so if somebody has had a lot of orthodontia, or they've had breaks to their face, or they've had a lot of damage, even past a nose break, they can develop that scar tissue through here, and it'll show up in that first point. So if it's in that middle point, that second point, you're going to have more scar tissue that's formed along this area of the zygomatic arch. And one thing to note about that zygomatic arch is it's pretty wide. So it's not just this line, it can be all the way up into the right against the eye socket and all the way down and around. There is a nerve that comes out right through here, so be careful as you tuck into that pointy part of the bone. We want to stay on top of the bone. And that's going to come out to about here. And then we have that third point, that's that most lateral point on the occipital ridge, and that is going to be anything past this high point of the cheekbone, that zygomatic arch as it blends into that temporal bone. So that's what we're going to be doing. And when we go and assess, we see which one of those points it's telling us to go to, and we go to that mirror of it. Now, there's one exception to all of this, and that is the clavicles will mirror the zygomatic arch. So if somebody's had a clavicle break, the clavicles will mirror the zygomatic arch and vice versa. So if somebody has had a clavicle break, they're going to show up with the same amount of scar tissue here. But the difference is when you go to work the back and do the assessment along the occipital ridge, when you apply the work here, it locks down harder on the occipital ridge. And that usually tells you that they've had a clavicle injury. And that clavicle injury can occur right here at the sternoclavicular notch, all along this bone, and even into the AC joints. And when it's in the AC joints, it's going to be clear back on the edge of that zygomatic arch on the temporal bone. So let's see what this looks like. I'm going to go ahead and I'm going to assess his neck again. And we have that second point on the left. So I'm going to come in and I'm going to bilaterally assess. And the reason for that is his neck is telling me there's a problem with this area of the bone, but I wouldn't know what it was unless I'm comparing it to this opposite side. So as I come in and I feel, I can tell that it's a little bit different right here than right here. And that's where we're going to apply some of this work. And it doesn't take a whole lot of work. And you can do this with or without lotion. And then we're going to come back and check that occipital ridge. Now, the interesting thing is this occipital ridge has locked up in response to injuries that are close to the eyes. And we've already talked about the vestibular ocular apparatus. So the body is making micro adjustments when there's injury or impact to the face to protect what's going on with the eyes. So the body has made micro adjustments through all of these tissues in order to protect the eyes on the horizontal plane. So what you're going to find is as you do this assessment, you are going to be taken on a little journey. That's why it's called the release technique, where you might be working on the left side on one point, and it'll take you to the right side on another point, it'll take you to the center point. You literally have to work and assess and work and assess because it's going to be releasing things as the eyes lay down the scar tissue for balance. So as I come in and do my next assessment, it's actually right here in that first point, almost central on the right side now. So I'm going to bilaterally assess again, and I'm going to feel through those nasal sutures. I'm looking for something different on this side than this side. And as we come down, it's right there, right through this area. And it's going to be right along that suture line. And I'm going to work through that until the two feel similar. So this side is just feeling. This side is actually breaking down. And we're going to come back and I'm going to assess. And it's taken us to almost the same place on this side. And I'm going to come in and assess. All right, and it's kind of starting to lock up just a little bit. So I'm going to come down into his chin. And you can work the chin at any time. I'm going to break things apart here. And if it locks down harder, then it's telling us to go down to the sternum, the sternoclavicular notches. Come back and check. Nope, it was his chin. Everything's starting to let go. So now it's taken me over to the second point along that occipital ridge on the right. I'm going to bilaterally assess. This side is different than this side right here, like there's been an impact to that cheekbone. And I'm going to continue to work assessing with this hand, breaking down with this one until they feel similar. And then I'm going to come back and assess again. Now, what's starting to happen is this whole side is starting to lock down. So now we're going to come down to the clavicles. I'm going to take a little bit of lotion and work it along those clavicles, and I'm going to be looking for something on this side that doesn't match what's on this side. So this side is incorrect. I'm going to take my thumb and my fingers, and I'm looking for anything that feels crunchy or stuck right there, different than that side. And I'm going to continue to assess all the way out, and I am on top of that bone. I'm going to assess all the way out to the AC joint. So the thing that felt different was right here, and that's almost the insertion of the pec on that clavicle. Now, to check and make sure we are doing what we need to do, come back and assess, and that whole neck has really started to let go. I'm going to make sure that this is cleared out. You can probably even see that flipping around on the video. And check all the way out to those AC joints. And come up and check that occipital ridge. All right, it's taken us all the way to that most lateral third point on that left side. So I'm actually going to follow the zygomatic arch out, and I'm going to bilaterally assess, and where it feels different on that left side, we're going to work and make it match the right, and come back in and check again. And now it wants us to do the same thing on this side. It flipped on us. So I'm going to come over. This side's right, the left side's right. The right side is going to have something a little different. And that can happen if you've had an impact maybe towards the cheekbone here and the back of the head over here. It's still going to show up that way. That's why you have to make sure you go through that whole zygomatic arch, and we've got just a little bit right here at the back. And if you're ever wondering if you're working on the right spot, you literally just need to feel and check and feel and check and feel and check, and it can guide you to the exact location that you need to be in. So that is how we do that C1 release technique.